Thank you so much for coming. Before we get going, I do have a black eye. Everyone's wondering. I bumped my granddaughter's head.
Yeah, that's what he wants to.
And I told my husband the undersheriff's here, so you better get ready. Okay, so we'll get started. Are we good with the video? Mike, are you good? Okay. My name is Lynn Forbes. I am the co-president of the League of Women Voters here in Nevada County, and my co-president Jan Badane is here, as is the rest of our board. So let's get going on the panel concept. So it's been a whirlwind 6 months in the new Trump administration's new term. More than 157 executive orders have been issued, maybe more at this point. More than 275,000 federal civil service layoffs have been announced. That's 58,000 confirmed cuts, more than 76,000 employee buyouts, and more than 148,000 other planned reductions, which equals a total of 12% of the 2.4 million civilian and federal workforce. And the reduction in personnel and other actions have impacted many federal departments, including Education, Homeland Security, Department of Energy, USAID, Consumer Financial Protection Bureau, the Veterans Affairs, EPA, Health and Human Services, Department of Interior, IRS, Small Business Administration, and the Department of Defense. According to the DOJ website, more than 25,000 federal contracts and grants have been terminated. So all this to say that these are not just actions that are happening in a faraway land called Washington, D.C., that these layoffs and these cuts and these freezes and these mandates have real implications right here in our own backyard. And we have invited leaders of our community in major sectors of our community in Nevada County to help us understand what all this means to our local region and to our people. And with us today, we have Lynn Rudd, who is the, did I say that right? Scudrud. It's Scandinavian. Who is the new executive director of the Nevada City Chamber of Commerce. We have Lisa Swarthout, who is the Nevada County Supervisor for District 3. We have Under Sheriff Sam Brown. We have Dr. Scott Neely, who's the executive director of the Sierra Memorial Hospital. And we have Erin Metler, who is the Chief Fiscal Officer of the county. And we have Christine Kelly, who is the Executive Director of the nonprofit foundation, community foundation, the new foundation here in Nevada County. So what we've done is, we know that there are many categories, details, or I would say granular categories that are not necessarily specifically represented here, but we're confident that our panelists can speak if necessary to these areas. And if this model is a success, we can envision perhaps replicating it in the future with leaders from other sectors, more granular sectors. So before we get started, we want to remind you that this is a nonpartisan discussion. We are not here to slam or applaud any federal actions, but simply to shine a spotlight on how they are affecting Nevada County. And we may have some time at the end of our panel discussion for questions. If you are interested in asking a question, please raise your hand and one of our people will come by with an index card and a pencil, and they will be screened for appropriateness and for repetition. That's it. Okay. Paper. Again, thank you so much for coming. I think that people are very confused about what this really means to us here. So we'll get going, and I'm looking at this as more of a conversation than just an inquisition. Please feel free to speak up when someone else is, well, don't interrupt anyone, but you know what I mean. Please feel free to fill in and add on to someone's comments. And again, the whole purpose is to shed information, to share information with our community. So we'll start down there with Lynn, and we'll just go down the line with the first most basic question, and that is, how does your sector interface? And so, Lynn, you are representing small business community, not necessarily the chamber itself, but small business community. How does your sector interface with the federal government, both in funding and policy? And if there's any direction that your people who are getting from the state, does it conflict with federal mandates?
Yeah, so I would say we're a little bit unique in that sense. Hey everyone, so I would say we're a little bit unique with our small businesses in Nevada County, and especially my background is with Nevada City. They're very small businesses, so they tend to not have too much direction from the federal government or even too much from the state government. The biggest thing that's impacting them potentially is SBA loans and access to capital that they need for their businesses. But otherwise, really, they're primarily working with our local government, so city and county level government. So really, our businesses tend to not interface too directly with our local businesses. Some larger businesses do, but for the most part, our smaller businesses that we see in Nevada City don't. But we are definitely concerned about staffing cuts at the SBA. I did talk to our one of our SBA representatives that we work with today, and he feels pretty confident right now that there will be loans available and that we won't be seeing too large of a decrease in the amount of funding available for loans. But at the same time, it still will impact our local community.
Did you want me to repeat?
Yes, please.
Okay. How does the county interact, or interface, I should say, with the federal government? And as much as in funding, in both funding and policy, and as much as you can you explain how the mommy state and the daddy feds, how you're getting, are you getting consistent direction? Are you in the middle of cross purposes there?
Thank you, and thank you very much for having us here this evening. I'm going to answer part of that, and then Erin Mettler is our CFO. She's more the expert in some of how the grants and things work. So county government is very heavily supported by federal and state grants, and often they're what they call pass-throughs. So the money goes from the feds to the state and then down to the county to run particular programs. So I think what we're going to see is certain programs are going to be cut, and if you've watched the news, you can kind of tell they're going after, in my opinion, the most vulnerable of the population by cutting Medicaid and cutting SNAP and some of the other social services. We have not gotten a lot of official word from the feds yet about what actually it looks like, because they don't know, because they haven't passed a budget yet. But I will say, just like business and the stock market, government is no different. Uncertainty is not good. And so we are in some very uncertain times right now. And I'm District 3 supervisor. I represent all the sectors because I represent all the people who live in my district and the work that they do. I represent Grass Valley, which is the majority of the business community. Small businesses in western Nevada County, the majority are in the city limits of Grass Valley. The hospital is in the city limits, although a bunch of the schools. And so my district, I think, is going to be particularly impacted from on the business side. And one of the things that Lynn didn't mention, but I think potentially is going to hurt small businesses, is the tariffs. And again, it goes back to uncertainty. I'm a 30-year, third-generation retailer. That's what I did for my real job back in the day. Before I became county supervisor. So I have a lot of empathy for what our business community is going through right now, because there's a lot of uncertainty about, are we going to have inventory on the shelves at Christmas? And, small business runs on a very small margin. COVID was very hard on our small businesses, and not everybody has fully recovered. So now you tack on tariffs and no access to capital and all the other things that go along with running a business. So I think I'll leave it at that. I'll let Erin speak a little bit more to specifically some of the cuts that we are looking at. Just real briefly, I will say one of the boards that I sit on in my role as a supervisor is the Area 4 on Aging, which is the 6-county consortium for pretty much the Older Americans Act. Money is distributed from that entity into the Area 4, and that's what supports our Meals on Wheels and some of the other programs that we have for our senior and disabled community. I got an email yesterday that Meals on Wheels has been saved, which is really good news, that they're going to fully fund that to last year's budget. But there are some other programs, falls prevention and a couple other small programs that are funded through some federal and state grants that are probably going to be impacted. We are still in the very early stages of knowing what the actual effects were going to be, but potentially it can be pretty devastating for a small rural community in our sector, in small business, and then also what Dr. Neely's going to tell you about how it potentially is going to affect our medical care here. So I'll leave it at that.
Thanks. Sheriff Moon was invited. Unfortunately, she's down in Sacramento. She's appointed on the Commission for Post, which is the Peace Officer Standard and Training. And so she gets to help shape guidelines and the way that we're going to train and have our standards for law enforcement. So we're pretty lucky to have that, but it ties her up, and unfortunately you guys get stuck with me. So when I originally was asked, hey, can you talk about like what this is going to be, the impacts, I was like, well, how am I going to describe that? It is much like you had just said. It's like two divorcing parents that occurred. And with the two divorcing parents, I'd love to see it more like one's buying your love and sending you to Disneyland, and then the other one's buying you gifts. We get like presents and toys and stuff. But more of what we're facing is the parents that have two different sets of rules within their houses, and they don't line up perfectly. And so for us, a lot of people, maybe not as much of an impact in Nevada County, but definitely throughout the state, is obviously the immigration enforcement, things of that nature. California has very specific laws that were designed through Senate Bill 54, the Values Act. And that does not allow law enforcement in California to participate in any way, shape, or form. I shouldn't say in any way, shape, or form. There are very few exceptions for immigration enforcement. And the times that law enforcement can be involved in California are for criminal matters, where somebody has actually committed a crime. And I think most people can agree that if somebody is committing a crime that causes an undue safety issue in law enforcement throughout California, they're going to enforce those things. So if there's a federal warrant for criminal nature, or if somebody is convicted of a crime that is considered a serious or violent felony, those are times that we will participate. And that includes our jail with communication. There's very strict rules about how we'll communicate with immigration enforcement and things like that. There's lots of rights for people that are incarcerated, where we do a presentation once a year for the Board of Supervisors to kind of talk about those things and what happens. But there's lots of forms that are provided to the people that are incarcerated. They only are required to submit to interviews with enforcement agents under consent, and they have the right to have attorneys. And there's various things that occurred. It's very formulated. It was set forth by the state through a lot of acts. And there's actually three. There's the Values Act, the Truth Act, and the Trust Act, and those all kind of come together to mold where we're at. But we're also in a weird spot where then we're violating what the feds are telling us to do, which is they want us to jump on board and do immigration enforcement. We're like, well, we can't. So we end up in this really weird situation where we want to be good partners, but also it makes it extremely difficult. So at the time, the information that's being shared with all of the state sheriffs is that we're going to comply with the Values Act in California. And again, I think for Sheriff Moon's perspective, and I think most people, if somebody's committing crimes within our community, we want to hold them accountable. So just because you're an illegal immigrant, you shouldn't have protections that we wouldn't have where we're here. If you're committing crimes and you're harming people, we do want to hold those folks accountable and make sure that they have to deal with the justice system if they do something wrong. But we're not allowed to participate with immigration enforcement. For funding and things of that nature, so far, no changes. Again, this is probably Erin's like the expert, but she's probably not going to be the expert because it's super confusing anyway, but we meet as a group and we talk about a lot of these things. We do have some grants that come from the feds. Most of them are washed through the state of California, so that becomes weird because California has to change maybe what their qualifications are to obtain a grant, things of that nature. And so we're still waiting to see what those are going to look like, but we do have a few grants that support our mobile crisis team and some of the different programs that we have. So we're tracking that and trying to watch it. Right now we see no changes in the future that are occurring right now, but that could change tomorrow. And so we try to just pay attention to the various grants and funding that we have to help support our systems and the way that we operate and run. But it's just one of those things where you're watching it on a daily basis. You know, one day they have a list of counties and cities that are sanctuary cities and not cooperating, and they're in threat of losing all that funding. And then I'm getting an email from the National Sheriff's Association, which represents about 3,000 sheriffs throughout the country, that kind of fired back on that and said, hey, why are you doing this? What were the qualifications for that? And then all of a sudden the site's going down. So, we're living in confusing times, and I think we try to do the best to navigate it and try to keep fears down as best we can. I think we're doing a pretty good job in Nevada County to do that. We don't face as many challenges sometimes as some of these other locations that are closer to the border and things like that, but funding is definitely a concern. We put in a grant for an indoor shooting range. That's a congressional funding that we're asking for. I shouldn't say grant, I guess. But at the same point, that's a huge deficit if we don't receive that. And so we'll hopefully know more in October, but maybe if the way they keep passing budgets, it'll be closer to April, and at that point, that would be a big hit for us if we didn't have funding like that. So we try to pay attention to it, be good neighbors, comply with state law, and try to thread that needle as best we can with our two parents who don't love each other anymore.
Okay, good afternoon. First, I want to thank the League of Women Voters for asking the hospital to be represented here today. And I'm going to talk primarily in hypotheticals. We don't actually have a reconciliation bill that has passed both houses at this time. I'm sure most people in the room realize that we have a reconciliation bill that has passed in the House of Representatives by a single vote, and now is going to the Senate, where we do expect changes. So we can talk really about what we think the impact might be if we saw a version of the reconciliation bill similar to what the House passed. And let me back it up and talk a little bit about how the hospital depends on federal funding. The hospital has net patient revenues in the hundreds of millions of dollars. And with that said, we are essentially a break-even hospital. And what that boils down to is that 45% of our revenue comes from Medicare, and about 25% of our revenue comes from the Medicaid program, which we call Medi-Cal here in California. Those revenues are less than what it costs us to take care of the patients that are funded by Medicare and Medicaid. So we are funded, we are reimbursed at rates that are below our cost of care for those patient populations. And we break even because we actually have a small but reasonable excess of revenues over costs for the 12% of patients, 12% of patients who we admit who are funded by commercial insurance. So the overwhelming majority of our patients, 85%, have government funding. It's because the average age in Nevada County is on the upper end of the spectrum. And so nearly 60% of our admissions to the hospital are for patients who are funded by Medicare. Now, the current proposal that has passed the House of Representatives would represent about $800 billion in funding cuts for the Medicaid program over about a 10-year period of time, and would also represent somewhere in the vicinity of $500 billion in cuts to Medicare over that period of time. Now, we know that we got reassurances that the Medicare program would not be touched, but there are some complex funding rules around Medicare. The one that is of concern is called pay-go or pay-as-you-go. As the federal deficit increases, there are rules for cuts to the Medicare program that are automatic and are phased in as that deficit increases. So the current version that passed the House does project about $500 billion with a B dollars decrease in Medicare funding over a 10-year period of time. So you can do the math. That's a projection of about $1.3 trillion in actual decreases. A lot of times when you're hearing about federal government funding and so-called cuts to funding in the federal government, you're actually talking about decreases in the rate of increase. But in this instance, we're actually talking about actual cuts to both the Medicaid and the Medicare program. And those cuts would represent about 8% of funding for those two programs over that period of time. Now, 8% doesn't sound like a lot, but as I always remind folks when we talk about something like a 1 or 2% cut in physician rates for Medicare, that 1 or 2% comes off the top. And our margins are already very thin. So if we experienced, for example, an 8% decrease combined in Medicare and Medicaid funding, as I said, broad brush, very hypothetical, but if we experience cuts of that magnitude, our losses would be quite significant. The other thing that's very important about the bill as it currently stands is that it includes restrictions on a kind of arcane and strange program, but one that's very important to us, called the provider fee. And I won't, at this time at least, try to explain how that fee works, but it is a program that provides extra funding to hospitals that experience a greater share of the burden of taking care of Medicaid patients. It's recognized that we are reimbursed at below our costs to care for those patients. So when we have a greater share of those patients, we get more of the provider fee. It's coincidental, but at this time, the amount of money that we get from the provider fee, about $12 million, basically corresponds precisely to our margin. And so our hospital, which has a challenging financial picture to begin with, would certainly experience very significant negative financial impact as a result of this bill if it passes in its current form. And you know, that's a big if. We are certainly hopeful that we won't see it in its current form. A couple of other points to consider as we talk about these things. 25% of the residents of Nevada County have Medicaid or Medi-Cal as their primary health insurance. 25%. 50% of the live births in Nevada County are insured by Medi-Cal. Work requirements for that group of people would definitely result in a decrease in access to health care for really the most challenged people in our community. And there have been actually measurable improvements in health outcomes for folks who are funded by Medicaid since the advent of the Affordable Care Act. That increased funding and increased access to health care has been associated with true improvements in mortality rates and other indices of health for those people. Some of that is kind of hidden in the federal statistics because we saw an increase in the rate of death from opiates during the same period of time, but you can tease out an actual benefit to those folks who are funded by Medicaid. Another thing, going to sort of a completely different topic, but one that is actually very important to this county, is that the hospital contributes in excess of $100 million annually to the economy of Nevada County through the salaries that we pay, the salaries and benefits that we pay to folks. We're the largest private employer in the county by far. And it's estimated that in rural communities, every dollar spent on healthcare results in well over $2.50 in economic benefit to the economy of the county. When rural healthcare facilities are forced to decrease services or to contract, it oftentimes results in significant economic hardship for the communities in which these hospitals close or are forced to reduce services. So economic hits to healthcare facilities, the healthcare system are very wide-ranging. Healthcare is very expensive to fund, and it's not an easy picture. The proposals that we are looking at make it a lot harder. It makes what is already a pretty challenging area more difficult for the operators who are trying to keep these facilities open. And this is certainly a far greater risk in rural communities than in other parts of the country, where healthcare funding is even more dependent on these government programs than it is in urban areas. So I'll stop there, but certainly we'll look forward to some questions.
Thank you. Do you want me to
I have the question here. So I might just remind the audience, we're talking about how we interface with federal government, both in funding and in policy. For Nevada County, about half of our annual revenue is federal and state funding. And so of that half, about a third of it is federal. So about $60 million comes to us from the federal government each year. Those are primarily in our Health and Human Services departments, which is your social services and behavioral health programs, primarily through Medi-Cal. We also have significant federal funding in our roads and transit division that helps us keep our transit system alive and well, helps us meet electric vehicle mandates coming from the state. We have federal pass-through monies for a lot of those improvements. With HHSA programs or Health and Human Services Agency programs, we do leverage our local tax dollars against state dollars, which is then leveraged against federal dollars. So it's kind of a three-part funding source for a lot of those safety net programs. And so any change to the formula allocation coming from the Fed is going to impact the state's allocation, and that's going to be passed through to the county. And so while we have local dollars that are available to maybe smooth out that impact in the case of a very sudden cut, we don't have enough resources to completely make that whole and keep the service levels stable. And so from the county's perspective, as we're developing our budget for 25-26, we really are being very cautious about extending ourselves in particular ways that might not pan out in terms of that funding coming through. We also, although our budget proposal doesn't include it, we have several contingency plans behind the scenes for what if. As others have said before me, there's so much unknown. There has been unknowns. There will continue to be unknowns. And so as government, we're obligated to make sure that we think thoughtfully about that before extending ourselves. Or if we are going to extend into a contract, for example, there's language in that contract that speaks to what happens when the funding doesn't come through. It gives us the ability to stop that work from happening, to pay for what we have and costs that we have incurred at that point, but not have to go any further. So there's things like that that the county government uses as safety nets, if you will, that will allow us to continue to service the county residents in our best way that we can. But unfortunately, in this time of kind of upheaval and indecision, nothing surprises us these days. Every single day there's something new that we then have to manage and navigate through. And really our approach has been, how do we keep our mandated services going? How do we keep a base level of services to our residents? And how do we smooth out some of those big, huge fluctuations? So very simple answer for a very complex problem. And thank you for having us today.
Well, the nonprofit community, as most of you are probably aware, is downstream from federal, state, county, and a lot of the nonprofits in this community are funded directly by the county, that have contracts and grants that come from the county. And so we're seeing a lot of uncertainty in the nonprofit community, primarily from that downstream effect. So not a lot of nonprofits interface, in this community at least, while they don't interface directly with the federal government, they are going to be experiencing tremendous, sort of shifts and changes in this political environment. One example, and of course the nonprofit community in and of itself incorporates the arts and culture communities, science, health and human services, children's services, aging, food banks. Food banks, for example, many of them rely on USDA commodities. Not that there are cuts at the USDA, we're going to be feeling it here in Nevada County. Circle recently was notified that their AmeriCorps program has been cut. AmeriCorps is for most of you probably know what an AmeriCorps program is, but Circle's been relying on that program not only to provide really critical services for river monitoring, but also to help launch a lot of people into careers in science and technology. So the entire sort of scientific community is also in upheaval right now from a lot of these types of, a lot of the uncertainties at the federal level. In the arts and culture sectors, many of you may have heard that the NEA has been fairly well gutted at this point. So there have been arts organizations in Nevada County that have received NEA funding, the challenge grants, which may seem small, but $25,000 to a small arts nonprofit in Nevada County can make a big difference, right? It makes a difference between, for example, all third graders getting to see a Shakespeare play. So I think that there are tremendous implications, and I know that we have a lot of questions to get through, so I'll just stop there.
Well, you hang on to the mic. Well, I'll take it just so I ask the question into the video. So faced with the fears of the cuts that may or may not come, all of you sit in back rooms and, well, you mentioned it a little bit, Erin, and make contingency plans or what if plans or brainstorm about what you might need to do. And can you talk a little bit about what your process has been for considering what the next steps might be and how you do plan, how are you planning?
I am both a nonprofit consultant and the CEO of the Community Foundation, and I see a lot in my clients that, nonprofits, and for all of you who contribute to nonprofits in this community, thank you for doing so, but they also operate without the cushion, for example, that the county government has. So most nonprofits are not carrying the types of reserves that you would need to weather these types of cuts. So what they're having to do instead is actually, think about having to make cuts themselves, either in services and or in staff. And of course, as Dr. Neely was stating, that's going to affect us downstream, right? Because we'll have staff cuts, or people may lose their jobs, they're not going to spend as much in their community, etc. So trying to take, I think, specifically for direct service organizations, it's very difficult for them to have any type of scenario planning without understanding how this is going to first hit at our local level. But I would also say that the donor confidence right now is quite low. So in uncertain environments, you also have voter confidence is low right now, and donor confidence has a tendency to follow consumer indexes in terms of consumer confidence. So there's where we would need donors to try to step up. We're concerned that the donor community is not going to be able to step up, and it's going to put a big burden on our nonprofit community here, and for the generosity of our community as well.
So as I understand it, you're concerned about several factors. One is the funding, the donor dollars decreasing because people don't know how to spend their money or if they should spend their money. And then the trickle down effect of layoffs and so on in other sectors. And then the third is actually the funding freezes and grant freezes. Is that correct? And can you talk a little bit about what grants have experienced freezes in the county?
We're not aware of many at this point because again, a lot of the county nonprofits are specifically tied to tied to state and county funding, which is kind of again downstream. So we don't know a lot about what that's going to look like. I do know that, for example, that phase 2 FEMA funding was cut. That will affect our fire safe council and our firewise communities. So that's a very direct hit. And of course, in this community, nothing is probably more top of mind going into fire season than the support of those entities. So there's still a lot of uncertainty and a lot of unknowns about how this is going to generally play out because we're waiting to see the budget be passed.
Erin, same question for you. And there's so many departments and so many moving pieces involved in putting together a financial picture and budget for the county. So how do you even approach this? What's the process? I mean, you talked about contingency plans, but that sounds way too easy, contingency plans.
Well, I don't do it all myself. A couple different things. So the county hires and pays for lobbyists, both at the state and federal level. It's, in grand scheme of things, it's a very small contract for a wealth of information. And so what we use those lobbying firms to do for us is tell us what's going on in the legislature. What are they predicting? What are they seeing? What are they hearing? And how is that going to directly impact Nevada County? It's super difficult to hear these big, huge billion and trillion dollar numbers on the news and equate that to Nevada County. And I can't even do that. No, perfectly honest, cannot do that. However, we have a lot of smart people that are helping us navigate that trickle down. What does that look like for Nevada County? And so when we talk about contingency plans, each of the departments that has state or federal funding is responsible for navigating their own budgets in terms of understanding the restrictions and the policy direction tied to those funds. Our Office of Emergency Services, because you mentioned our FEMA grants, I think weekly I was getting updates from their department head back from January through April. And we had funding, we didn't have funding. We had funding, we didn't have funding. We had funding, we didn't have funding. Now we have some funding, not all funding. So it's those conversations that we're just routinely having. We're spending a lot of time thinking about things, talking about things. How can we get the work done if this funding doesn't come through? The example of wildfire mitigation and preparation, we had a planning grant through FEMA that while we were able to keep that money, it was immediately kind of cut off, and we had to wrap up the plans that we were in the process of creating. The benefit of having the plan is that we have future opportunities for grant funding either through the state or if the feds open up the funding again, we now have a plan in place which makes us more competitive when it comes to grants. When you're able to tell the funding agency, this is what we plan to use it for, this is how we're leveraging local dollars, this is the benefit to our community, you're much more competitive because you can tell a better story. When it comes to other departments such as our public health department, they lost some COVID funding unexpectedly, but rather abruptly back in March. That was unfortunate, and we were planning for that funding to go away next year. So we had to kind of scramble and say, okay, what's being funded through that particular source, and what other funding can we have to either supplement it, backfill it, or is it a contract situation where unfortunately we have to plus a stop work order on the contract. And as was mentioned, we do contract with a lot of nonprofits, but also a lot of small businesses in our community to do the work for us. And so when our funding gets cut and we have to impact those contracts, that is another direct hit to our local economy, and sometimes the whole business relies on that contract.
Are layoffs a possibility?
And not for the county. So county layoffs are not contemplated in our budget proposal. Unless there was a catastrophic cut to a specific program, I don't see layoffs. And if there was a catastrophic cut to a program, we would likely try very, very hard to place that person or those people elsewhere in the county to preserve their employment.
Thank you. Dr. Neely, for your brainstorming with your advisors and such at the hospital, 85% on Medi-Cal or Medicare is an amazing statistic. That's kind of blows my mind. What do you, when you're planning what might happen, how do you start to wrap your head around that? I mean, a lot of hospitals shut down labor and delivery, for instance, and send their pregnant women far away to have their babies and such. What are some of the contingency proposals that you've come up with?
Well, I'm not going to make a very good interview here because I'm not going to speculate on things that aren't facts, and we don't have facts yet. One thing I will tell you is that we're not closing the hospital, we're not closing labor and delivery, and we don't have any intention of closing any clinical services at this time. We, as you've heard already, depend very heavily on federal funding of a different sort. It's directed by patients. We also depend very heavily on patients who are commercially insured when they come to the hospital. I like the competing for grants language. I have to compete for patients. My competition is called Down the Hill. We have the opportunity to repatriate, what we call repatriating, patients who currently electively leave the county for medical care, who could, in most cases, get their medical care at the hospital. And my principal strategic approach to our financial challenges over the last few years has been to improve the quality of our product and to compete harder for patients. That's the American way. And that will continue to be our tactic going forward. We are recruiting physicians. Physicians give us the capacity to care for people. Surgeons give us the capacity to do surgeries that we couldn't do before. That is going to be our principal response. I don't have any plans right now for massive belt tightening. That obviously is always something that we could be forced into, but we have no intentions right now to do layoffs. Layoffs are not in our fiscal year 26 budget. We're starting a fiscal year on July 1st. Our approach across not just Sierra Nevada Memorial Hospital, but Common Spirit Health, which is the largest not-for-profit healthcare company in the United States, is to get better, compete harder, and to try to grow our business. The not-for-profit healthcare system is not looking at this current challenge as being well-timed. We have been slammed by the combination of the post-COVID recovery and the high inflation rates that we've been experiencing over the last 2 to 3 years. We're in the same markets as everybody else, and inflation hits us in the same way. You can't get 2.5% increases in rates for medical care and 5% inflation and have a rosy financial outlook. So that's what we've been working against in the not-for-profit sector, and that goes for Sierra Nevada. It goes for all of Dignity Health in California, which cares for more Medi-Cal patients than any health system in California by far. We have been working really hard to come out of a very, very challenging period of time, and this feels a little bit like piling on, but we'll be continuing to continue up here.
So, when you are considering what may have to shift, change, what are some of the conversations and brainstorming that you guys have?
I'd say, one, I'm very thankful because we have a great relationship with Erin and her team and lots of entities throughout the county that help us come up with clever ways of how are we going to get through things. And so we have really good teamwork that I think helps to get things moving along. So we don't expect a lot of changes overall for the Sheriff's Office. The Values Act, I'll go on policy first. So, on the Values Act stuff, that's been out since 2018. So we've already been operating under the whole, we're not going to participate with immigration like enforcement and things of that nature. And it's a state law. What we face is now, are we violating a federal law to comply with the state law, and which one do we want to contend with? And so I think that'll get hit at a much larger organizations or sheriff's offices somewhere else if that does come. For instance, you challenge the federal government by what they would consider harboring an illegal immigrant in your jail by not giving them access, but the Values Act prevents us from doing that unless they consensually would like to do that. So, we face some of these unknown challenges in the legal world that just haven't existed really, but we don't expect any changes to how we do business on law enforcement itself. Our staffing is solid. We face more challenges on staffing, on being able to hire people and get people interested in law enforcement or corrections and things of that nature, animal control, all these things that are going on. But those have been challenges for quite some time. They've gotten worse through COVID and through all these political changes and the different things you see across the news that, with social media, everybody feels the impact of something that happens on the East Coast when in all reality that's not what's happening in Nevada County. We feel really great community support for our law enforcement, and we're appreciative of that. And I think that's because of the reputation we try to build with the folks that are in the community. And so I don't see any of that changing. We do still face some financial type of challenges, much like the hospital. The state came out with this really great program called CalAIM, and they then told jails that we're going to start doing Medi-Cal within the facility for the first 30-ish days, and then the last 90 days that they're in, and then there's some caveats in there, and it's going to be all Medi-Cal based. But I do not know anything about Medi-Cal. I'm learning a lot, and this has been a monster of a project. But again, it's not for full funding, but we have to have positions to support the tasks that they're asking for. And then as we've gone on to build out this program, and our hopeful go live date is October of this year. Then all of a sudden they're pulling waivers where maybe there isn't federal funding to pay for those types of things, and then the state's coming out and saying, no, we'll cover it. And as much as I see Erin and I trust that she's fighting hard for your tax dollars, because I have to fight with her sometimes to, hey, I need this, and she's like, yeah, no, it's not yours. I don't know what they're doing at the state level, and I don't know where that's going to come out. And at the end, there's a lot of responsibility that comes with that, but those long-term effects for things like CalAIM, where we love the idea of providing better medical continuity for people who are incarcerated, because if they get out, they're going to be better people when they walk into the streets. So when you're looking at substance use disorder and things like that, yeah, they hit the hospital and they go a lot, because I've been in the ER and I see the same people that we have in the jail. It's the same. But they're looking for care, and they're looking for help, and the idea is that if you can have that continuity of care where they walk out and they have prescriptions and they have things, that they're going to be better off to treat them. And honestly, that's better for everybody in this room, and it's better for the community. And you may have had family members that are incarcerated. We have people that work with us, their family members are incarcerated and things of that nature. And we don't want anything other than to return them better to the public than they came in. But again, when you create this monster of a program that really wasn't funded, and it was being promised funding from the state, and so we start building out this program with some temporary positions, things like that, we do have risks that come along with that. And I think that's what we're trying to pay attention to the most. Most people know we have a mobile crisis team where a licensed clinician rides with a deputy sheriff. We have 2 teams. The sheriff's goal was to have 4. She really wanted 4 teams. Well, financially, that's really expensive, so we're still at 2 teams. And we only had 1 initially when we started. But we see the value because a lot of times as a deputy sheriff, if I'm going to detain somebody for if they're a danger to themselves, danger to others, or gravely disabled, I'm taking them over to visit Dr. Neely's staff over at the hospital. And so now we're clogging up the hospital system. Yeah, they love us, I think. And I've sat there as a deputy sheriff for many times, and you're waiting a long time. Well, the benefit of having a licensed clinician that meets a person at their residence or at their location where they're in crisis and actually can talk through it, conduct assessments, and determine, do they really need to go to the ER or the ED? Do they need to wait for hours on end for lab tests and all these things, when really most of them are going to probably walk out the door? And unfortunately, when you clog that system, then the system's slower, and so then you can't get through things. And so, having some of these programs have real impact. And so we fight really hard for that funding. We try to put together really good documentation of why we need it. Erin's team's always great with us to help work through those things. And so there are challenges, and there's more of those types of programs that we really have to argue for funding. But right now, we don't know of any of that being at risk. So we just continue, like the doctor said, and try to pay attention to those things and wait for facts.
So contrary to what you might have seen the local op-ed of the paper, the county is actually very fiscally conservative. I've been up there a little over 2 years now, and I came from city government, so $30 million budget, and then you go into a budget of $380 million. Just trying to wrap your head around what that means and the differences. But the county has had some great policies in place over the years to make sure that we have a very healthy reserve. And at the state level, they call that the rainy day account. We don't call that the rainy day account at the county. We call that our emergency account. And every year in January, we do a board workshop, and we determine what our policy goals are going to be for the year. And I think right now, there's 8 or 10 up there. And some of those things are what we call core services, that we are required to do those. We have to have a jail. We have to have an elected sheriff and coroner and public administrator. We have to provide an animal shelter in the county. So those are the things that we will continue to do, hopefully, at the same levels of what we're doing now for funding. But again, it goes back to, what are your priorities, and is this a true emergency, and do we have to backfill some of these things until we get some more stability from the government? And I'm just going to offer my opinion because I'm only one elected, but for me, the most important services that we have to provide are the safety nets for our people of shelter and food. So the monies that go to those programs such as SNAP and the Section 8 housing vouchers and various federally funded and state funded programs, we potentially, if this is truly, if these cuts all come in, we have to figure out as the county how we're going to make sure that our basic services for our population are provided, and especially children and our senior population here are most vulnerable. Yesterday at our Board of Supervisors meeting, we had a presentation from Bright Futures for Youth, which they serve a great sector of our population here, mostly kids between the age of 12 and 18, 11 and 18, sorry, you know better than me, work with them. But one of the statistics that was very startling to some of us is that 1 in 7 children in Nevada County are food insecure. There's also 1 in 20 kids, mostly teenagers in Nevada County, are they're not unhoused, but they don't have stable housing. They're considered homeless because they don't have a permanent place to live. They couch surf or they stay with friends. And so those are the kinds of things that, as a community, who do you want to be? I want to be the community that takes care of our most vulnerable people. So I will tell you, I'm very confident, not with my colleagues on the Board of Supervisors and then with all of the fantastic staff at the county, that we will figure out a way out of this. Back in November, after the election, and I am an elected official, so I can talk more politics than anybody else, and I know that this is bipartisan, but I decided based on what happened at the election that I would put my head down and work for the best of my community, because there's not a lot I can do to affect the federal government. Like Erin said, we do have lobbyists, we do work very closely with our state and federal elected officials, but rural communities are different. We don't get the same benefit as the urban areas, and oftentimes the state creates policies that hurt the rural communities, and where you can provide a service in a large area for a lot less money, they require us to provide the same service and it costs a lot more money to do it here. So we'll continue to look at all of our programs. Again, we don't have any actual cuts that we have received yet. I mean, we know that they're coming. We are prepared. You know, back in January when the governor talked about the budget, and he was very clear, and I listened to him very closely, that the state was going to backfill a lot of the social services programs, and then the fires happened in Los Angeles. So I think all that money that they had is now going for to help the people who were affected by those fires. So things can change very quickly, and we as the government, we have to be able to react and change with it. And I think that is what our group is really willing to do. We're going to do the best that we possibly can. If anybody's interested, next Tuesday at 9 o'clock, we have our budget hearings. So there'll be a presentation on our budget. I will tell you, I've been there this is my third budget cycle. It's very complicated. It's taken me this long to really understand it. But hopefully we will be able to explain it to the public so you can see where your tax dollars are going, and know that we are doing the best that we possibly can with the revenue sources that we have.
Well, Lisa touched on this earlier, but I'd say anytime there's uncertainty in the economy, then people start to contract their spending. And it essentially creates a self-fulfilling prophecy where people contract, so it causes an economic downturn and the cycle continues. And I think we're sort of right now a little bit on the verge of that. We're seeing our businesses, when I talk to them, some of them are feeling okay, some are doing well. Others are, seeing people spending less, or they're seeing people are still coming into their shops. They're seeing just as many visitors into their shops, and yet their average sale price is significantly lower. So we're seeing a lot of changes right now, and there's so much uncertainty that I think we're still feeling it out and seeing what will happen. Other businesses are telling us their sales are up for the year, so it's definitely inconsistent right now. But tariffs are a huge impact on our community and are really creating and adding more to the inconsistency because they're on and then they're off and they're on and they're off. I just had a conversation today with one of our business owners, owner of Brewbuilt Brew House, and they were notified this morning that there was going to be a 25 to 50% tariff on aluminum and steel effective immediately. And that impacts their business so much, but ultimately that cost is passed along to the consumers because there's small margins in businesses, and so they have to increase their prices, which then leads to more inflation. So it's a challenging time, I would say, with businesses and tariffs and navigating that. In their case, they're bringing the aluminum in for bottling their beer, the steel is for their kegs, and so there's all these raw materials that you can't necessarily source locally in the United States. It has to be imported. On the other hand, though, I would say as a community, we're a little more isolated or sort of insulated than some communities are. A lot of our businesses really already focus on sourcing locally, and especially with our restaurants. We have a lot of restaurants that are sourcing their food locally in our community. Even a lot of our businesses are using local artists and things like that. So we see less and less of that, and more businesses are taking advantage of using local services. But again, as I mentioned, the raw materials often still have to be imported and are subject to tariffs, which is, as I mentioned, every day is different. Yesterday they thought they weren't going to have the tariffs on steel and aluminum. Today they are told they do. So it's been a really challenging time, and as a chamber we're working to support our members the best we can and help them navigate and educate them. But again, every day is different, so it's hard to educate because it's constantly changing. But really just doing what we can to support them, and then also bolstering our local economy however we can. So really just encouraging our community to shop local now more than ever. I think that's really important, and if you can keep your money here in Nevada County, that makes a big difference. Not only does it keep our businesses alive and thriving, but it keeps our potholes filled and our police services available. It keeps those tax dollars here. So I'd say that's really important. Just shopping local, supporting our local community however you can. And that's the main thing that I wanted to touch on for that.
Okay, thank you so much. We're going to wrap it up. I have a couple of more specific questions. Erin and Lisa,
The compensation that we get, because there's a lot of federal land in our district, and that is under threat, I understand. Is that correct?
I think are you referring to the Schools Act?
The Schools Act, yes, yes,
Rural
yes.
Schools Act. So they actually have restored the Rural Schools Act through Congress, through a separate bill.
That one.
Yeah, and they also did it in perpetuity, so it doesn't have to come back and be reauthorized every year.
Okay.
But if they did cut the Rural Schools Act, it didn't affect Nevada County as much because we don't have as much federal land as some of our communities up to the north. I looked at it, our school district, our superintendent's office was going to take about a $350,000 hit. And that is money that they use for special education and programs that the schools don't always provide for everybody. But I looked at some of the other counties like Trinity and Alpine who literally get half of their budget from those dollars that was going to be cut. So fortunately, it did get saved.
Okay.
But it just so you know, what that is that if you live in a county where you have a lot of federal land there, they help backfill you because federal land doesn't pay property taxes. So they help backfill that because of the loss of property tax revenue. Again, that is it's strictly for rural schools, but it's a really good snapshot of the differences between being in a rural environment versus an urban environment. Just knowing that you're not going to get property tax on millions of acres that are not developed because they're all federal land. Although it sounds like the federal government is going to be selling off some federal land. Hopefully not in California. Hopefully in California we're not going to let that happen, but you never know.
Thank you. Sam, can you talk about, I assume that the Sheriff's Department works very closely with Grass Valley and Nevada City Police Departments. And per your information about the Values Act, what happens if ICE shows up in our community? There was a rumor that there were ICE agents at El Favorito. Did you hear that one? Did anybody hear that? Somebody told me about that. That ICE agents were having lunch or whatever, having a meal at El Favorito on Mill Street at 20. Which I'm not saying that happened.
Tell them who they actually were.
I'm not saying that happened, but I mean, what would happen if ICE agents showed up in our community?
I'll answer and I'll let Lisa talk about whatever happened at El Favorito. I will say, funny enough, I was driving out of the route center. We saw people putting on tactical vests over by the jail, and we drove out. And I was like, "What was that?" And so we got to about where our property unit was. I have to turn around because if my boss gets caught off guard, then I'm going to get in trouble. So I pull back. We're like, "Hey, what are you guys doing?" They're like, "Nothing." And we're like, "Yeah, no." Anyways, it ended up being they were California DOJ, and they were actually doing firearms inspections. And so they do knock and talks for people who are prohibited persons from possessing firearms, and they follow up. So good work, in my opinion. And they do call our dispatch, and they get on our call logs, and so we're aware that they're there, and then it's happening. To say we can't prevent the federal government from coming in and doing what they're going to do. I will say that. We watched it in Sacramento and lots of different locations where they're going in. I don't want to speculate on tactics and things like that. All I can say is that we're going to try to be present and make sure we're supportive of our community members and keep the peace and things that do go on. And I think Grass Valley and Nevada City would agree on those same concepts. I will say this. I don't want to portray the federal government as the evil demon, because the reality is they're human beings that are being given policies and directives. And we have really good relationships with a lot of our FBI partners, with HSI, which is the Homeland Security. We have sometimes large cannabis investigations. We have the IRS and the DEA. There's a team called EPIC that helps us that through a grant called DSET for cannabis eradication. And these are all really good partnerships. So it's not like they're not evil people. The direction that they're given or the things that they choose to go about comes from policy, and they're trying to do hopefully the best that they can in those circumstances. I'm hopeful that we don't end up with something like that in Nevada County. We're going to show up to make sure that things are peaceful and that we're doing the best we can to be good partners. But at the same point, I don't know if everybody's watched all the scenarios with judges where they think it's best to intervene against the federal government. Well, you're committing a crime by doing that. And so again, where I go back to, do I violate state law or federal law? Federal judges are on a whole other level than a state court judge. And that's not necessarily the end that I want to be on either, but I do want to make sure that we're providing, as best we can, a safe environment for our residents here.
And just
really briefly what happened a couple weeks ago, and I got a text from somebody. So someone said, "Oh, I just saw this posted on, I think, some social media site where, you know, ICE agents just rolled into Nevada County. They saw a whole bunch of black SUVs come up." So I immediately texted the sheriff to find out what the actual story. It wasn't ICE agents, it was people from Fish and Game and State Water Agency who were coming up here to assist the sheriff's office with some illegal cannabis grows, because while cannabis is legal, there's still a process that you have to go through. And then the largest threats of illegal cannabis in our community are to the environment. So we take that really seriously.
Also, that's great, they're putting tax dollars into Nevada County, right? The biggest thing is that we chase for cannabis is for environmental crimes, and so the Water Board and Fish and Wildlife and all these entities that are coming out and assisting in that, it's because it's a different world of what we're chasing and why we're chasing. And so, again, where we go back to the federal partners, not all being bad, their evidence recovery team has come up and helped us. They helped us during the Kylie Rodney search up in Truckee that went on for a long time. They are really hardworking people that are they're just like us in this room. Policies and directives, by the way, that people vote and whatnot, that dictates how things are going to go, and try to do the best we can.
Dr. Neely, the hospital is the hub for the medical community here, and I'm wondering what the reaction has been to various proposals from NIH as far as vaccinations and medical advice, and how that sort of trickles down at a local level.
Complex question. The good news is the local medical community is really well integrated. We actually have a Zoom call every Friday morning at 7 a.m. Where we have Dr. Cook, our medical officer, local practitioners, and both hospitals as well as community medical practice represented. It's an information sharing session and is tremendously valuable in terms of how are we dealing with this issue right now. The federal government's change in course with respect to vaccines is not something that has really sunken in or had a lot of direct local impact. I think that there's always the possibility that some of the messaging that is coming out will support or embolden people who are skeptical about the safety and the value of vaccines. And that will not be good for our children if that occurs. We already have actually some of the lowest vaccination rates in the state in Nevada County. Our vaccination rates are below, for example, what you would need to actually have control of a measles outbreak. If we did have a local measles outbreak, we'd certainly be at risk because we know that our vaccination rates are low. And so what our medical community does about things like that is share information. Now, we haven't had that outbreak yet, but for example, our emergency department providers are very well versed in what to look for. And quite frankly, we're expecting it. It'll happen one of these days. But we share information, we try to be prepared. One of the things that we have shared information about, for example, is the way that people counterfeit vaccination records, which is quite a busy little cottage industry, apparently, in Nevada County. But our local providers have seen everything, and they share that information. And so they're very interesting calls, and it's a wonderful group of people who really have you all in their hearts and are here to make things better for their patients. So hope that answers your question.
Just real general to anyone who wants to answer. We're going to wrap this up. Have you seen any positive change to the changes? Has there been anything that you think is a benefit of the changes that you've seen in the last 6 months? Anybody?
Actually, yes.
Okay.
So one of the benefits that we've seen is we've gotten really good about knowing where our money goes
Yeah.
and what things cost. And we've gotten really good about identifying what is a need and what is a want and what is a nice to have. And that's nothing different than anyone with a lot of common sense would do for their own personal budget. But when you use government and we're talking about $450 million, it's a little tougher. And also super important that every dollar that we put into our budget has a purpose and has been vetted and is a need and also addresses, you know, what the community wants and what they have expressed a desire to have. And we balance that, right? We balance those needs and those wants against the resources that we have. So I think that's been a tremendous benefit as a result of kind of these threats of cuts coming.
I'd say that it's kind of pushing us towards more collaboration and more sort of cross-sector looking at, you know, how can we become sort of more efficient? How can we address ideas that are, address ideas and take care of people locally, right? Instead of the reliance on something that's going to come. I think we're starting to think more, we're thinking more broadly about local. And I think that that's a good thing that's coming out of this and has some great potential for our future.
Collaboration is a great way to end this. Thank you all so much. Every single one of you, just very enlightening and very informative. Really appreciate your being here and really want to thank you. Thank you all for coming. Thank you for supporting the league and thank you for supporting our community. We'll continue having these panels perhaps in the future if you guys think that's a good idea. And have a great evening. Thank you so much.